Harrison, well, today is Tuesday. Our Two Works For You dentist, Dr. Kevin Winters, here to answer your dental questions. Welcome. Let's get right to it today. Alice says, quote, I have an issue with bad breath. How can I fix it?
Well, I hate to give you some of that news, but probably the thing that's going on there has to do with gum disease. One of our leading contributors to bad breath is actually the bacteria and stuff that's associated with gum disease. Now, a couple other things to consider can be the cleanliness of your tongue. So in addition to brushing your teeth, you can also brush your tongue. They even make tongue scrapers that clean them just a little bit better. One more thing to consider there too would be acid reflux. So if that could be going on, that's a big contributor as well. So be sure to speak with your physician about that.
All right, next question. Gene says, my dentures have been loose. He says, I've been to a denture clinic, but they don't help. What can I do?
Yeah, usually what we run into with loose dentures has to do with the bone support. The longer your teeth are out, the more the bone tends to resorb, and so you have less support for the denture. Typically, lower dentures fit much worse than upper dentures. So when it gets to a point that doing things like relines and stuff like that aren't helping, then the next step that can make a dramatic difference for you is the addition of dental implants. So there you can connect the denture, give it some support, and not have it moving around in your mouth, especially when you're chewing, sometimes even when you're talking. So you may be at the point where a dental implant can make a big difference for you.
For a lot of people getting those too.
That's right.
And last question here, Alice says, one of my front teeth is darker than the other. Why does this happen, and what can I do to make them match?
Right. Well, probably what happened is at some point in the past, you had some type of blow to that front tooth. It was injured. And the injury to the tooth over time has actually killed the nerve within inside the tooth. And it doesn't necessarily have to hurt, but the nerve is dead, and so the tooth darkens. With that being the case, there's some things that can be done with bleaching that are very unpredictable. But the best thing to do would be to find someone who's very capable in cosmetic dentistry and look at placing a porcelain veneer on the tooth so it can match the other tooth exactly. So that's probably your best bet.
Okay. And if people have more questions for you, how can they get in touch with you?
Website, tulsadentalcare.com. Also, our office number is 918-528-3330.
All right. Thank you very much. Well, if you have any other questions for Dr. Winters, you can also post them to our Facebook page at KJRH TV. Tanaya?